All right, let's get an update now from the Department of Health, which says the Mpox outbreak in South Africa remains under control. The officials are saying that they're on high alert for any surges to infections or for any emergencies should any of the strains become more prevalent. The department's spokesperson is Mohale, and he joins us via the virtual platform. Mr. Mohale, good evening to you, and thanks for your time. Let's begin with the statement that you are starting with at the top of your media statement today, and that is that the Mpox virus is under control in South Africa. If so, how many people in total are being monitored and are admitted or being treated for this virus?
Good evening to you, Ekoli, and good evening to your viewers at home, and thanks for this opportunity. Yes, as the Department of Health, following an announcement by the CDC and the World Health Organization, which declared the current outbreak of Mpox as public health emergency of both continental and international concern, we want to allay fears in the country that currently the situation is under control, but for now, because we can't predict what might happen tomorrow. So, meaning that for now we are able to contain. We've managed to contain the situation based on the epidemiological and surveillance data that we have, based on the rate of transmission that we have. So far, we've recorded only 24 laboratory confirmed cases, of which 3 have demised, 18 have fully recovered, and only 2 they are about to conclude their home isolation. So in terms of frequency of recording the cases, we haven't recorded the positive cases for the past 7 to 9 days. So unlike at the beginning of the outbreak, where we were recording an average of 3 cases per week. So for almost a month without recording a single laboratory confirmed case, that shows that our efforts, both contact tracing, public health awareness, surveillance activities, have managed to assist us to contain the spread of this infectious disease for now.
Yeah. So when you say the country remains on high alert, what measures are in place to ensure that you prevent any surge of this virus? Because as you will know, that there is mutation in these viruses, and one of those has become really of huge concern, particularly in the Democratic Republic of Congo.
Yeah, no, definitely we are working with a number of stakeholders like your NICD, National Institute for Communicable Diseases. We are working with the World Health Organization country office, which assisted us with the current batch of treatment. We are working with the Border Management Authority, which has intensified their health screening at the ports of entry to ensure that people who are coming into the country, especially those who are coming from other affected countries like your DRC, they get screened, and those who experience Mpox-like symptoms, they get referred to the nearest healthcare facility for further clinical evaluation and possible testing. But also, we are closely monitoring the situation in other countries like DRC, as you have just indicated that they are experiencing the more contagious strain or variant. So we are trying to, as you know, that the diseases or the viruses have got no boundaries and discrimination. So we are closely monitoring the situation, working also with our neighboring countries to ensure that we compare the notes, epidemiological data from time to time, just to check and establish the burden of disease, so that if we happen to experience a new variant, a contagious variant, at least we'll know how to deal with it. But also we are currently considering a number of vaccines around the world, which we will be able to procure. But for now, there's no immediate pressure for us to secure vaccine, but we need to identify this vaccine so that as soon as a decision is made for us to procure vaccine, we know where to go and procure this vaccine and for how many people and the cost of that vaccine. As you know that normally during the outbreak, vaccines are very new and they don't come cheap, as you we learned during the time of COVID-19.
Yeah, yeah. And you are urging the public, seeing that we don't have a vaccine yet, you're urging the public to continue paying attention to non-pharmaceutical measures, including personal hygiene. What does that mean in practice? What exactly do we need to do as members of the public to make sure that we don't contract this virus?
Yeah, as this is the song that we used to preach during the outbreak of COVID-19, that we encourage people to maintain personal hygiene, wash their hands from time to time. You know that we shake hands with people. Sometimes we shake hands and we go and eat without checking. So we also encourage to say anyone who experience Mpox-like symptoms not to self-diagnose, because we've learned from some of these cases or patients that some of them, as soon as they experience Mpox-like symptoms, they conclude and diagnose themselves and rush to the nearest pharmacy and procure or buy on-the-counter medication without even knowing or being sure what kind of a disease or condition they're treating. So hence we encourage anyone who experience Mpox-like symptoms to say, please just present yourself to the nearest healthcare facility. But also we say those who have tested positive, let's support them. Let's encourage them to take and complete treatment as per the instructions of the healthcare workers. We say, please, let's avoid sharing items like clothes, utensils, blankets, and so forth, so that we try to mitigate against a possible transmission of this infectious but preventable condition.
Foster Mohale, thank you very much for the time being, sharing with us information on how to take care of ourselves in order that we avoid contracting this scary virus. It is a scary one because it presents with very, very difficult symptoms. And as you've heard him say, 24 cases in total have been recorded in South Africa, and out of those, 3 people have sadly died. But by and large, things remain under control.